This is the case of fibroelastoma of posterior mitral leaflet. Papillary fibroelastoma of posterior mitral leaflet. You can see in this image, this is the PML, and the tip of PML is having mass small in size, likely to be papillary fibroelastoma of PML. In next image, again you see the mass in PML, and posterior to posterior wall, that is pericardial effusion, and posterior to pericardial effusion there is left sided pleural effusion. So whenever you have confusion between pericardial effusion and pleural effusion, you have to find out this is descending aorta in cross section. In transverse sections you say anything posterior to that one is pleural effusion and anterior to that one is pericardial effusion. In this image you can easily see, next image, this is aorta in short axis, or you see aorta in transverse section. This is pericardial effusion. This is left sided pleural effusion. This is aorta. So aorta in transverse section, effusion posterior to aorta is pleural effusion, anterior to aorta is pericardial effusion. The image in the upper side of the skin is most anterior one. Image in the lower side of the skin is the most posterior one. So effusion that is posterior to this aorta is pleural effusion, anterior to that is pericardial effusion. Whenever you see both effusion, you can easily see this is pericardial effusion, this is pleural effusion, this is parietal pericardium. You can exactly measure the thickness of parietal pericardium in this image, even better than CT scan also. Same time again you see the fibroelastoma of posterior mitral leaflet. At the same time the posterior mitral leaflet is getting flail. The tip of mitral leaflet is coming inside the left atrium, that is flail PML, obviously leading to severe mitral regurgitation. Mitral regurgitation is eccentric, anteromedially directed. You can see this is anterior directed MR close to aorta. So whenever you find this kind of MR, by auscultation you may confuse with aortic stenosis murmur, because the jet of mitral regurgitation is anteriorly directed towards aorta. So murmur wise you may confuse it aortic stenosis murmur. So in this case what we have learned that how to differentiate between pleural effusion and pericardial effusion. Posterior to descending aorta in short transverse view, posterior to descending aorta the pleural effusion, anterior to descending aorta pericardial effusion. This is fibroelastoma of PML leading to severe MR. Obviously PML is getting flail due to this tumor. The causing severe MR, direction of MR is anteromedially directed. Anteriorly directed, so auscultation wise it is likely that we get it confused with aortic stenosis murmur. Again you see this is pericardial effusion, this is pleural effusion. This is the size of fibroelastoma of PML. This is the extent of pericardial effusion. This is right-sided pleural effusion. So ultimately, this is the case of papillary fibrolastoma of posterior mitral leaflet, pericardial effusion, severe anteromedially dilated, eccentric mitral regurgitation. Thank you.